Aside from our previous video, there's still some information you need to know about Britannia Petite. Parturition. Nesting starts for a few days or hours before parturition. The hair epilates easily as the estrogen level increases, and the progesterone falls. The doe plucks her hair in the abdomen, dewlap, and sides. She uses this fur to make a nest. Kindling happens in the morning for 30 minutes. Weaning. On day 18 to 21, the kids start leaving their nest and start to eat solid food. Weaning is completely done on day 42. Doe is taken out of the enclosure to make the kits become familiar with their enclosure. Weaning is critical as they are prone to illness. The milk protects the kids, but once it is stopped, bacteria enter the stomach. Newborn rabbit. The newborn weighs 40 to 50 grams. They are hairless, having sealed eyes and ears. They are not brooded by the doe. Their fur grows on day 10. They depend on the heat from each other. They rely on their sense of smell. They recognize their mother by the smell of her feces. There is a pheromone released near the nipple. This stimulates sucking. Mothers leave a scent on their kits. Sexual behavior. Adolescent rabbits become aggressive and territorial. They honk, mount, hump, chin, and circle. They urinate outside their litter box to mark territory, although they have been trained to use the litter box. Does chew during the nesting. Neutering improves pet quality. Enclosures. Despite being small, they are far more energetic than the other dwarf rabbits. Then, they should have an enclosure fit for medium-sized ones in order to give them enough room for fun. For indoor enclosures, you can have a wired one having a solid bottom. Putting them outside will bring them near their predators. Then, a waterproof and predator-type proof of enclosure is the best. Also, let the enclosure have good air ventilation. Keep it under a shade too. Clean the bedding and get rid of droppings. Replace everything that has to be changed. Take them out for some time to play in a safe area. It will help them burn calories, for they are so energetic and love cuddling. They want to bond with their owner and sunbathe. Get to introduce them to other bunnies too while they are young. If they are inside your home, secure all the wires, plugs, and even your furniture, for they might chew and get electrocuted. Common rabbit diseases. Rabbits experience common health problems and diseases, but these can be prevented before it gets worse. Owners should understand the needs and signs of sickness. Careful and close observation is vital. Here are some of them: hairballs, snuffles, overgrown teeth, calicivirus, uterine tumors, and myxomatosis. Overgrown teeth. Owners must know that the rabbit's teeth grow continuously for their whole life. If they don't grind their teeth by eating fiber, then their molars would form like a sharp spike, which can hurt their tongue and cheeks. Then eventually, they will not eat. The incisors in front will grow, which will prevent their mouths from being closed. They will not eat, then die. Give them food rich in fiber like grass or oat and hay. Then, the rest would be pellets and the green leafy ones. To treat, burying the teeth flat and general anesthetic is the way to correct an overgrown tooth. Snuffles. This is transferred through close contact of a healthy rabbit to an infected one. The bacteria cause discharge, squinting, and redness in the eyes or nose. It can affect the ears and bring out abscesses and infections in the urinary tract. When your rabbit's immune system is affected by a new diet or overcrowding, the bacteria get stimulated in the nasal tract. Thus, stress has to be reduced, and new ones have to be quarantined. Giving antibiotics in repeated course or surgery to get rid of the abscess. Hairballs. Rabbits are self-groomers. They tend to eat their fur. Knowing that they cannot vomit, the hair cannot pass through their gut, which will be formed like a ball. The rabbit will not eat and go lethargic. To prevent, feed them with enough fiber to help the hairballs pass through their gut. Surgery is the treatment needed sometimes, and medication for the gut to keep working is another option. Uterine tumors. Does are prone to this. If an undesexed doe gets sick, she can have this. Signs are cysts in the mammary gland, aggressive behavior, vaginal discharge with a blood stain, and lethargy. Desex them at 4 to 6 months. Desex to stop or prevent cancer from spreading. Rabbit hemorrhagic. It is spread by mosquitoes too, or even flies. Signs are fever and lethargy or sudden death. Most rabbits show no signs. Other signs are restlessness and poor appetite. There will be blood clotting and damage to the liver. Vaccinate your rabbit. Move them away from wild and domesticated rabbits. Don't feed grass as it might be contaminated by wild rabbits. Wash your hands before you hold them. Have insect control. Isolate the infected one. There's no treatment is available. Caring for a house rabbit. Buying supplies. Get a large rabbit for your rabbits moving. Give your rabbit a safe place. Let him feel secure and safe in this cage. Buy enough bedding for the cage's bottom. You can try hay, straw, and shredded paper. For wood shavings, don't use pine, cedar, and scented ones. Set up litter boxes. Put a cover on the boxes. Come up with various types like wood shavings, silica cat litter. Don't clump the litters. This can be swallowed by your rabbit. For the food bowl, use a ceramic one. It is ideal since rabbits like tipping their food bowl. The sides should be high but not low enough for comfortable seating. Provide a water bowl or dishes. Give them lots of hay. Hays will be useful for their digestion. Timothy hay is ideal for them. You can line your litter box with hay too. In addition, hays are digging spots too. They somehow sort of entertainment for them like hiding their treats. To supplement hay, offer pellets, veggies, and fruits. Don't give too many pellets to avoid an overweight rabbit. Avoid fruits having high sugar content. You can always ask your vet for the right diet. If your rabbit is healthy, they don't need vitamins. Carrots should be served in moderation. Give various toys for entertainment. For a chew toy, the applewood tree is good. Clean it before giving. Choosing your rabbit. To care for a rabbit needs energy and time. Despite being a low-maintenance pet, they still require money, time, and care. They need food, water, toys, litter boxes, and your attention most especially. Allot 3 hours a day for playing with your rabbit outside the cage. Human interaction is important. You can introduce them to other rabbits but house them separately. Choose which kind you like. There are various breeds and sizes to choose from. Choose if you want a male or female. You can check breeders, pet stores, or rescue centers. Check pet stores, rescue centers, and breeders to find a rabbit. If you want to raise a kit, you should know how to care for it, for there are guidelines set. You can ask the owner about the temperament. You can choose a friendly kit. Look into the parent's health, size, temperament, and color to have an idea of how the kits will grow. Choose one that sniffs and hops going to you. Check the health condition too as indicated by the following: bright and clear eyes, clean ears, smell-free, untangled and clean fur, no parasites on the skin, no clumping issues, excited and responded, no issues in dental, hair loss, nasal discharge, and illness. If you want to be sure about the temperament, get an adult. You can find them in rescue centers. Don't get the aggressive ones, and most importantly, they must be healthy. Keeping your rabbit healthy and safe. Find an experienced vet. Take your bunny for regular checkups. Handle your bunny the right way. Learn how to pick it right. To hold, scoop it with an arm with your other hand under. Move it near your body to support. Improper picking can lead to jumping or injury. Ensure your rabbit's safety by covering or remove anything that can harm your bunny. For instance, our electrical wires, cords, and more. Don't cuddle them too much. They don't like this. They feel like being hunted by birds. Be careful of nipping, once you don't stop stroking or hugging them too much. Educate your kids on the right way of interacting with the bunny. Tell them not to scream or yell at them. Don't let the kids chase them. Rabbits will feel threatened. Teach them to be gentle. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.